Ladies and gentlemen, in this video, I will speak about PCOS. What should we do with polycystic ovary syndrome? Let's go.
So depressed when I can't seem to get out. But something deep inside won't let me quit. I swear that I'm inspired by you.
Hi everyone, this is Nima and here is Be Fit and Healthy by Science YouTube channel. We will speak about PCOS. At first, we want to speak about PCOS. What is PCOS? Polycystic ovary syndrome, or PCOS, is a common endocrine disorder of unknown cause that affects an estimated 3% to 12% of women of reproductive age in Western society. The condition is characterized by reproductive issues such as amenorrhea or other menstrual irregularities, anovulation, enlarged ovaries with multiple cysts, and infertility. More generalized symptoms include insulin-resistant, acne, hirsutism, excessive or abnormal distribution of hair growth, male pattern baldness, weight gain, and sleep apnea. This is PCOS. For medical management of PCOS, I should say hypothyroidism occurs in some cases of PCOS. Laboratory tests for thyroid function are frequently normal in patients with clinical evidence of hypothyroidism, and treatment with thyroid hormone result in clinical improvement in many patients. Therefore, an empirical trial of thyroid hormone should be considered for patients with PCOS who have clinical evidence of hypothyroidism. Okay, thyroid antibody status should be taken into account when considering treatment with thyroid hormone in women with PCOS. Metformin frequently is prescribed to improve insulin resistance, and treatment with this drug may lead to resumption of ovulation. Other therapy include another drugs may be beneficial too. After that, we should go to medical nutrition therapy or MNT that we should focus on it and pay attention to it, because nutrition in people with PCOS is so important. Nutritional intervention that may be beneficial for women with PCOS include dietary modification designed to enhance insulin sensitivity. This includes recommending a low glycemic load diet. I will speak about low glycemic diet and what is low glycemic index and low glycemic load diet. Consuming high fiber foods and preventing excess weight gain via calorie awareness and promotion of physical activity. Eating a diet that keeps blood sugar balanced, including combining low glycemic carbohydrate with protein, and eating smaller meals may also be of benefit. It is important to ensure optimal nutrient status for vitamin D and to screen to suboptimal thyroid function. After this, I want to speak about a table that pay attention to important factors in PCOS for medical nutrition therapy or MNT. Nutrition therapy for polycystic ovary syndrome. First factor that we should pay attention to it is obesity. For obesity in PCOS, institute weight management program of diet and exercise. Next factor that I want to speak about is insulin resistant. This is so important in PCOS. For insulin resistant, people should restrict refined carbohydrates, should use low glycemic index diet, and restrict total calories and increase high fiber foods. Another thing that should do for insulin resistant is they should use small and frequent meals. Monitor carefully to ascertain benefit from high versus low carbohydrate diet. Consider supplementation with chromium picolinate. Next factor that we should pay attention in PCOS is vitamin D. We should check vitamin D in people with PCOS. If she has low serum 25-hydroxyvitamin D, we should administer vitamin D. Next factor that we should do for medical nutrition therapy is clomiphene citrate resistant infertility. In these cases, we can use short-term NAC or N-acetylcysteine. Next factor that we should pay attention to it is laboratory or clinical evidence of hypothyroidism. For this factor, science suggests to institute thyroid hormone replacement and use food or supplement with selenium or iodine. these are things that I want to speak about PCOS. MNT or medical nutrition therapy is so important in PCOS. If you have PCOS or women that around you have PCOS and you do these things that I say to you, they are so helpful for you. At future, I will speak about PCOS more. Thank you very much. If you don't have subscribed our channel, please subscribe it and like this video. If you have any question, you can comment it. I will respond it. Thank you very much. Goodbye.